Welcome back to the Caribou Data Science Channel. It's the evening of November 6th, 2020, and hey, I got some phenomenal news for you folks in Michigan, or as we say in Ohio, you folks up north, okay? And we'll get there in just a moment because I want you to know that you are doing a phenomenal job, okay? Regardless of what the news media is telling you, what your politicians tell you, you are doing a phenomenal job. Your COVID-19 numbers, cases, deaths, are proving that. Actually, the deaths are clearly proving that. Okay. Now, before we get started, I just want us to take a look at a couple things here. This is the website for the University of Washington's Institute of Health Metrics and Evaluation. This COVID-19 team was actually quoted once in August on NPR.com, and then in September on USA Today / YahooNews.com. So we come look at projections. By the way, I'll be back tomorrow with my weekly with my to do my weekly projection / prediction for COVID-19 deaths for December, January, and February 1st. Okay, now let's look at daily deaths here. This is what I want you to show you. Daily deaths is the best indicator of progression of pandemic. Notice it says daily deaths, not cumulative deaths, not cases, not hospital bed usage, but only daily deaths. All right. So now we download our data, we unzip it, and then we take the US states and we copy it over to our working directory. All right. Then we open it back up. And what you can see here now, here's the data of the recorded data, I guess. This is cumulative cases and cumulative deaths. That's the only thing. That's what the file includes: cases, deaths, okay, and also the state. So we notice the cumulative deaths for two reasons. First of all, or cumulative cases for two reasons: because the cases go up and never go down. These numbers should never go down, but only up. Same thing with deaths. And that's when we plot those two things, first daily cases or cumulative cases, this is what we see: a trend upward, a continuing climb, a continuing trend in upward number, and the net total number of cases. Same thing with now this is a little more interesting. You had a really steep thing right here, but it does appear to have leveled off. Okay, but this is again you can tell this is cumulative deaths because the trend line goes up and never down. Okay, now next we want to plot the daily cases and daily deaths. Daily deaths are very easy to calculate. You simply deduct yesterday's cases, today's cases, which gives us 10. Then you just plot copy it all the way down. Same thing with daily deaths. You simply subtract yesterday's deaths from today's deaths. Okay, so now let's take a look at that number. Okay, now let's take a look at the daily cases death. This is the daily cases. Remember the spike back in April? Of course, the current spike, even nationally, dwarfs this right here. Now, I'm not sure why there's so much volatility. That's a bit of a mystery, okay? But now let's take a look at daily deaths. This is cases. Look at the difference between cases here. There are twice as many deaths back in April, May, and June as there has been so far since since September or since July. You had this long downward trend in deaths. Yes, it's coming up a little bit right now, but it's still probably between 25 and 50 deaths per day. Okay, still at a phenomenal improvement over here. And I'd be shocked if this actually comes back up to this level here. Okay, okay. Now I said I had some amazing good news for you. This is it right here. This is the daily mortality rate. It's simply divide the daily deaths by the daily cases. Okay. Now here, when you plot that data, this is what this looks like. Look at this. Look at the spike in mortality rate. Why? Because we had relatively low cases, but high deaths. Okay. There was much less difference between cases and deaths than there is now. That's why this spiked up to about like 20%. But now you got it under control. Now you got the deaths under cases and deaths under control, so it began to fall. Understand, this is 10% mortality rate. This is 5. If we take a look here, down towards the end here, okay, look at all these dates, say from October onward, that are under 2%. There's one is 2.6. There's two, it's 2. But all the rest of these are under 2%. Some even under 8%. My friends, that means you're doing something right. And that's the phenomenally good news. You're doing something right. There's no way that these numbers should be this low, this mortality should be this low with the number of cases and deaths you're having. Okay? Keep up the good work. Don't allow yourself to be misled by the media and the politicians. Nothing needs to change at this point. Okay? I would say that, what's the, okay? That's what I wanted you to see. Okay? That's what I wanted you to see, this incredibly low mortality rate in Michigan right now. So anyway, that takes this for now. I will be back tomorrow and I'll be running my own weekly projection, my own weekly prediction for COVID-19. I do a COVID-19 prediction for December 1st, for January 1st, and for February 1st. And maybe even February, maybe even, of course, January will bring us to the 1-year anniversary for the first reported case. And February 28th will bring us to the first reported COVID-19 death in the U.S. So we actually have some extra numbers to look at there, okay? Okay? But anyway, one more time, keep up the good work. Don't allow people don't allow the politicians and the media to mislead you on the numbers, to convince you that your things are getting worse. Things are not getting worse. There will be bumps, there will be speed bumps, but don't expect a major spike in deaths. And deaths is what matters. Thanks so much again for your time. We'll catch you on the next report.